Indiana, Pennsylvania has the best of both worlds. Small town charm and big city services are all available in the same area. The person who lives next door knows your family, cares about the neighborhood, and works in the area too. Indiana Regional Medical Center has small town charm. It is run and operated by your neighbors. The staff, nurses, and doctors are a part of Indiana, both in and out of their role at the hospital. In a world of big city corporate hospitals and national chains, Indiana Regional Medical Center has remained an independent and locally run healthcare provider. Larger hospitals focus on concentrating services to control costs. For patients, this can require driving a long way to see your doctor or receive various kinds of care. IRMC is different. Their focus is to bring specialists, technology, and a wide array of healthcare options to the Indiana region.
I think a lot of the hospitals in the area have felt the pressure from some of the bigger hospitals in Pittsburgh in an attempt to more or less take over these hospitals. And it hasn't been done kindly, and it hasn't been done successfully. And I think the independence that Indiana Hospital has maintained over the years has been a true benefit to them.
I think the people in the community feel that they own IRMC, and I think that's a good thing. It's an advantage being the sole hospital here, but I think that's probably the biggest plus that we have. I'm not sure you're ever able to reproduce that in the city when you have so many hospitals.
In the past 100 years, as Indiana has grown, so has IRMC. Designed from the start to be an integral part of the community, the hospital remains at its location next to Mack Park. IRMC really is Indiana's medical center.
When I first came to town, I would say, a number of encounters would be negative as I was out in the community, and that really has totally flipped. I mean, I'd say 9 times out of 10, and I rarely go anywhere without somebody sharing their experience, at the hospital with me. They're very positive, and I think the numbers would bear out that, we've seen market share growth of almost 30% in the last 15 years. We've more than doubled in terms of our overall revenues. So it's more than just a perception and a feeling. I mean, the numbers bear out that we clearly have, changed in our image and reputation. And even working with the business school students here, we've done a series of, surveys in the community about the impressions of the hospital. And those numbers have gone up every year and very, very statistically significantly. So I think, again, it's the people and the nurses and all the people over there are really the ones that make the difference. It's not me, I can guarantee you that.
Well, I'm hoping that IRMC stays an independent hospital. I think that it serves a vital role here in our community for the health of our community, and also being independent gives a different flavor to this hospital. We're not a subsidiary of some huge monster out of a major urban area. We're our own entity. So when you walk through those doors, you know that you can get to see the CEO, or you can get to see a doctor on call, and you're not going to be run around through 5 layers of bureaucracy, because this is the hospital here. And I think that that's a very nice thing for patients to feel like when they walk through the door, that they have some control. When you're in some of the huge urban hospitals, I think people they're following dotted lines on the floor to get from one place to another, and they feel kind of lost and overwhelmed.
I do think there's a strong sense of ownership. I think people feel this is their hospital. And what I like, most of the people live here, work here. It's your friends and neighbors taking care of patients, which I think also makes a difference.
The Indiana region is home to many successful businesses and organizations like Indiana University of Pennsylvania, Diamond Drugs Incorporated, S&T Bank, and IRMC that provide opportunities and employment to the region.
IRMC means local ownership. People in town who feel invested in the community. Most of the people that work here live here. I think it's the 2nd largest employer in the county.
I'm really proud of the fact that we've been voted a best place to work 15 times by our employees, including Fortune 100, and best place to work in healthcare, which is national. So, I mean, that's to me what it's all about, because, I believe that as employees feel like they're treated, that translates into the patient and family. And so, building that culture was probably the biggest thing we had to overcome.
Keeping healthcare affordable is important. To avoid merging with a large corporate chain, but to also share and control costs, IRMC has proposed an affiliation with the boards of directors of Clarion Hospital and Punxsutawney Hospital for early 2015. Though not considered a merger, this new step provides IRMC with the opportunity to expand the network of specialty physicians, improve access, and most importantly, remain independent with local governance and boards.
I think the overall landscape's going to change, and I think our ability to expand will continue. So challenging times create opportunities, and we're looking for those.
Some of the local hospitals that have been involved with some of the Pittsburgh hospitals have not fared all that well, and they suffered economically as a result. But I think that maintaining its independence has been one of the crucial factors in the success of Indiana Hospital.
It's a safe place that everyone knows they can go when something bad happens. So I think there is a lot of pride in the place. And I don't know if that was true 30 years ago when I came to town, but I really kind of get that feeling now that people feel that it's their hospital.
At IRMC, you'll be treated like one of the family.